So now let's look at what happens when you are actually doing shade matching. All of you look at the tooth, correct? You look at the tooth with your eyes. Everybody wants to give the best to their patient, correct? Nobody wants to go wrong. So by doing so, what do? You keep looking at the teeth. And now, please remember, when your eyes are at work, there is something else also working. And what is that? Your brain. And please remember, eyes have some limitations. Now I want all of you to look at this object and tell me what is happening to the dots.
White and black, they are becoming.
Sometimes black, see? So what does this tell you?
Some limitation of right.
Sometimes high value, sometimes low value. So when I'm looking at a tooth, same thing happens. It will tell me white, black, high value, low value, high value, low value. And then what happens to us? We get frustrated because my next patient is waiting. I cannot buy more time. And that is when I communicate A2. Check it, A2. Common. And when will this happen more? When you are working with single tooth. Single tooth restorations are the most difficult to match color. If I am doing canine to canine, I am the boss. My patient, whatever the patient wants, I can give.
Simple.
Very simple. But if it's a single tooth, very difficult. Single central, peg lateral, not so easy. So how do you get the value right? By doing something. You can't keep watching. So rule number 1 is, you should look at the teeth for less than 5 seconds. Be brief, be quick. Okay? And when you need to get the value of a single tooth, you need to break the accommodation. It's about accommodation. When I'm looking at an object for more than 10 seconds, my eyes will get accommodated. That is when we go into a confusion mode. Dark light, dark light. Are you getting my point? Same thing when we go and buy a perfume. Nose. We check on a white strip. A beautiful lady will give you check, you don't like it. Okay? Nose is accommodated now. You want to check the other one. What does she give you in between? She gives you something before you check the other one. Has anybody tried? They give you coffee beans. They give you coffee beans. That breaks the accommodation, and now you check the second one. Okay? But with eyes, coffee beans will not work. You have to look at a neutral object. In your clinic, when your eyes are accommodated, when you're in a mode of confusion, please don't continue. Rest your eyes, look at a gray or a neutral object, and then come back again. Is it very clear? Yeah? So this is extremely important. Left and right conflict. As I told you, it's all about brain. It's all about brain. The shade matching center for everybody is on the right side of the brain. But unfortunately for right-handers, the left side of the brain takes control very quickly. That is why in every book you see it's written, be quick, be brief. Because you want the right side of the brain to be active for that 5 seconds for you to match shade. Is it very clear? That's why I don't buy time. This is a very simple rule. Of course, now we have 2 different colors here. Basically, these are 2 primary hues, green and pink. Correct? Now, look at the cross. Please look at this cross and tell me what happens next. So please look at the cross constantly for more than 5 seconds and tell me what happens next. This is so very important. Okay? Please look at the cross. Look at the cross. Yeah? And now, anybody? What happened?
The shape.
Color has
Yes, colors have swept. You saw the purple here and you saw the green here. Absolutely. Absolutely. This is exactly what happens. So if I take a lot of time to get my hue from the cervical third, if my hue is A, my eyes will tell it is D, because what complements A is D. Are you getting my point?
Yes.
That's why you see a lot of patients with a gross mismatch in hue. So that should not happen. That's why be brief, be quick. Okay? This is very important. Okay. So this is the most important clinical tip. Please pick up shades before preparation of the tooth. Do not prepare the tooth and then take shade. That is wrong. Your eyes will deceive you. You cannot take shades after the tooth is prepared. Is it very clear? Do not desiccate the tooth. What do you mean by desiccation? No air drying. If you air dry, everything will change. It will modify the hue, it will decrease the translucency, it will increase the value, and it will decrease the chroma. Or everything goes wrong. Everything goes wrong. Never desiccate. Okay? Keep the tooth wet. Keep the tooth wet. Okay. This is very important in terms of color. As a structure, enamel allows 70% of the light to pass through. Enamel allows 70% of the light to pass through. Dentin allows only 52% of the light to pass through. What does this mean? Dentin is a very good blocker of light. Enamel is a very good transmitter of light. All our composites are also based on this. Any dentin shade of composite you use, it will not allow the light to pass through. That's why they are opaque. Any enamel shades you use, they allow very good transmission of light. So what you need to understand is the type of composites you use. In composites in the market, there are 4 different kinds of composites available to you. 4 different types, okay? One is the dentin composite, body shades, enamel shade, and effect shades. Effect shade is nothing but translucent shade. Now what is the difference between all these 4? Of course, I need all these 4 when I am doing a lot of aesthetic work in my practice. Okay? When I look at my dentin composite, can you read anything below through the disc? No. What does this tell you? It's a very good blocker of light. That means it will not show my preparation of the tooth. Suppose I prepare the tooth for a veneer, and if I place my dentin as the first layer, I will not see the color of my prepared tooth. Are you getting my point? So when will you use dentin? When you don't want to see your tooth color. You got understood? Suppose patient comes to you with discoloration, heavy discoloration. He wants you to change the color of your restoration. What will be my first layer? Dentin. Then I will place body, then I will place enamel. But if my patient comes to me and says, I like my color, it's not discolored, but I want you to correct the defect, then I will not use dentin. You got my point? Then I will use directly body. Why body? Because I can read something below the body disc. So what is the characteristic feature of body shades? They have chameleon effect. Have you heard about chameleon effect? It's the lizard. The lizard, wherever surroundings it takes up that color. That is the characteristic feature of body shade. So where will I use body shades? All my posterior composite, I use body shades. Class 3, body shades. Class 5, body shades. Class 4, veneer, also body shades. But if I want to change the color of the patient's tooth, then my first layer will be dentin shade, followed by body, and then enamel. Is it very clear?
Yes.
Even in posterior, when you excavate caries, if the dentin floor is very dark, then I place a thin layer of dentin to block that out, and then I put my body and I finish it. Is it very clear? If I look at enamel, see, all of you can read the fluoride really well, correct? Why? Because enamel allows 70% of the light to pass through. So enamel will only be my final layer on the top over the body. And the thickness of enamel is very critical. If your thickness becomes more than 0.75 millimeters, then the whole restoration will look very, very translucent. It will look very gray, grayish blue. Patients will not like it. So restrict your enamel thickness to less than 0.75. Now I will tell you how to use it, okay? Let me show you. Now all these are enamel shade. Can all of you see the enamel disc? Below is your dentin. Now you see at no point I have gone more than 1 millimeter, correct? Ideally it should be between 0.3 to 0.75. With 0.3, what do you see more? Enamel or dentin?
Dentin.
Dentin, correct, because it's 0.3. Light is transmitting, it's hitting the dentin, and that is what you're seeing. With 0.5, it's almost even, Steven. Okay, I see a little bit of enamel, I see a little bit of my body as well. 0.75, I see very little. And 1 mm, I don't see anything. That means 1 mm is dangerous. You will only see enamel. So when there is a lot of enamel, what happens is, there is a lot of light transmission. And patients, opposite person who is looking at the restoration, the eyes will only see the enamel. And then they'll feel, oh, something is very wrong, it looks fake. Are you getting my point? So keep your thickness up to 0.75. So I'll just give you a simple example. If I am using enamel shade on my older patients, I keep it this much. Because older patients have a lot of dentin or body visibility. If I am doing on adult, I keep it 0.5. And if I am working on young patients, I keep it maximum 0.75. Because I want translucency also in my younger patients. Is it very clear? So this is a very important parameter you need to consider when you're doing a veneer build-up. Okay? So that is why assess your prep. There are many people who don't do this. When you prepare a tooth to receive a veneer, first you see how much you have prepared. That will decide how much will be your layer thickness. Are you getting my point? So usually in a discolored tooth, my preparation depth will be more. It will be around 1.5 millimeters. Why? Because I need space for my dentin, I need space for my body, I need space for my enamel. Is it very clear? But for a non-discolored tooth, my prep will be less than 1 millimeter. So that means I need to only place 0.7 millimeters of body, 0.3 millimeters of enamel. Done. Okay? Some patients will come to you with only slight chipping. It's enamel chipping. So there I will not use body, I will directly place enamel. Are you getting my point? So you need to assess the case situation. You need to assess how much is the damage. You need to assess how much you have prepared. Based on that, you will place all your layers. A clinician who doesn't do all this, irrespective of whatever composites he'll use, he will go wrong with the shades because he's not assessed it correctly and he's not used it accordingly. Is it very clear? Everything very clear? Okay? Yeah, please.
So these measurements are very minute, right?
Absolutely. Very good question.
So
I knew this is coming. How will you be very sure whether it is this much or this much or this much? To be honest with you, it comes with experience. It is judgment because we do not have any instrument which would tell, this is 0.3, this is 0.5. No. It comes with your assessment. So assessment means when I am working, I am always seeing from this view. What is this view? Proximal view. When I am working 9 o'clock position, I am always seeing with my adjacent tooth how much I have to come out still with my contour. So please check, keep checking and keep reducing. Sometimes it may happen when you, for example, when you place a body shade, you have cured it. Now suddenly you will realize, oh my God, there is no much space for my enamel. So with composite you still have the advantage, you can cut back.
Oh, yeah.
Cut back. But cut back dry. Don't use water from the aerator. Dry cut back, again bond, remove all the smear layer, bond, and then place finer enamel. Okay? Initially it might happen, these things. But as you are doing more and more, you will get used to this thickness. Nothing to worry about. Okay? So a very good tip I will give you, always work a lot with body shades. Okay? When you know you're coming, you should have only very little space for enamel. And in older patients, I don't place enamel. I just finish it with my body because I want to see more body. The challenge will come only when you have to work with these two situations. Okay? So what is the moral of the story? I am not telling you be exact 0.75. You can be 0.6 also. You can be 0.55 also. It doesn't matter. But try to be less than more with enamel. That's the logic.
0.5 to 0.7.
Try to be less. It's a range. It's a range. You cannot be exact.
Yeah.
Okay? But try to be as much less as possible with enamel when compared to body.